Take a mental health break with the Mood Disorders Association of Manitoba and U Radio. Well, I know it's been a little while, but we're back with another episode of Mental Health Break with the Mood Disorders Association of Manitoba. Thank you for joining us again, Rita. How have you been doing?
Well, thank you, Ryan. Always a pleasure to come back and continue these conversations that are so important to us. We've been doing well. I think we've been extremely busy. A lot of people take time off in the summer to do things, get staff to rest. Our staff are extremely busy with some of the initiatives that we have going, because you know what, people's mental health doesn't take a break. And
definitely.
We need that support all year round.
Yeah, and we have a special guest today.
Oh, well, it's my pleasure to bring our newest team member, Elizabeth Gendron, who is our women's coordinator. She just joined us about a month and a half ago, and wearing the hat of supporting women in Manitoba with their mental health journeys. So it's going to be exciting talking with you, Elizabeth, telling us what some of the things that you have planned for the women's program, and a little bit about your own journey, about your mental wellness.
Elizabeth, why don't you tell us a little bit about yourself and the work that you do?
So my name is Elizabeth Gendron, and I just started at the Mood Disorder with Rita. So I had the privilege to have worked with her now for the last 2 months. A little bit about me. So I moved here about a year ago, and I noticed that there was a lot of roadblocks when it came to receiving support for mental health, because I'd moved from Ontario, and I really was interested in the idea of looking into getting support for, because I too struggle with mental health. I just somehow managed to meet Rita, and we ended up having a great conversation. I realized how many resources and support there are through the mood disorders, especially in Winnipeg, which is amazing. So it actually made me really excited to come and join the opportunity to work with mood disorders. I'm just starting now with the women's program, so we have a lot of exciting things to come.
We can definitely talk about this post-pandemic, Ryan, or even during pandemic, actually. Anecdotally, what we saw was women and youth were perhaps the most impacted groups. Women, because they were having to take on a lot of extra stuff that normally might be shared. But now they were dealing with aging parents who were living at home. Some of the folks are living intergenerational families. They were still continuing to work, but look after the families. Kids were home. Spouses, their partners were also working. There is always a tendency that I think the women end up having to take a lot more of the daily responsibilities in a household. So we saw that would cause I don't have some specific research that I can cite for you, but anecdotally we know that women were very strongly impacted. The other group, of course, was youth. And that was, the changes in their school system, the changes in one day they were in school, another day they were out, the things that kept going on. And
there wasn't a lot of stability.
And the social interaction that they lost, especially at a time when social interaction is so important for youth, children and teens, that some of that was lost, and so that had a huge impact on them. So I think those are the two things that we would love to talk about. Really want to continue the conversation today about women's mental health and wellness journeys. Elizabeth is going to share a little bit more about the programs that we have to offer, but I'm looking forward to continuing the conversation.
When we're looking at mental health, you're exactly right, talking about people going on holidays during the summer, but mental health never takes a break. And whether you're reading the news or just life in general, things can really sneak up on you, and it can take a dramatic effect. Elizabeth, when we're looking at the programs and things that you're going to be covering, what sort of aspects do you focus on, and what is the approach for helping in women's mental health?
So that's a great question. So what I've done for myself, so we do have quite a few programs that have been put on hold recently that we're actually just restarting. The biggest part that I did when I first started was I took on a lot of peer support. So that's one of the programs that we offer currently. And I listened to the women and what they had to offer, what they wanted to hear or get guidance and support with. So in the last few months, I've done a lot of, I wouldn't say research, but more just, gathering a lot of information from the women that have come forward, that have told me their stories, have told me where they want to focus on, where I see the need for support.
We were able to identify a lot of the gaps that existed in services and what women were saying, what they needed. And so our approach always is not we tell you what you need, we let the community and the individuals tell us what they need, and we meet them where they are in their wellness.
I think that's the right approach to do things, because in terms of mental health, it's not a one method fits all sort of situation. Everyone's experiences and what they're going through is unique. Right. Exactly, Rita. And you need to be able to see what they need and meet them where they are.
That's why we have our services already online, but I took those services and what I found from the women that do need the support, and we're custom designing programs purposely to support them. So just to give you an example of the support systems that we have. So like I mentioned, we have the peer support. So that's individual one-on-one peer support that I'm offering currently, where somebody comes in, or we do calls, or actually I would go to sites. So if they're at the hospital or wherever, to support them. Then we have some workshops. So we have the women's wellness workshops. The women's workshop is for just help them, find themselves, support them just overall.
Well, yeah, you need to be able to understand who you are and your needs personally before you can seek out help. I think that's an important thing.
You have to help yourself before you can help somebody else.
Absolutely. And that's such an important piece that I've noticed with a lot of women. A lot of them give themselves so much, but they don't ever give themselves, or they give themselves to everyone else, but not to themselves.
Yeah, the caretakers of a home, and oftentimes their emotional or often physical well-being is often neglected as well.
Absolutely. That's Brian, I'm really glad that you brought that up. Women by nature generally are nurturers. All kinds of research out there. I don't want to get into, things that are debatable. But generally, we know that women are. So as Elizabeth was saying, they will give themselves, they look after their children first before they look after them. They'll look after their family before they'll look after the aging parents before they look after themselves. What happens is their own well-being starts to deteriorate. They're not able to, because they're not getting it. It's new moms aren't getting enough sleep. They don't always have the new help that's needed. Just life in general causes them to neglect their diet, their things that other interests and things like that. So what we tried to do, and what Elizabeth has started to now work on, is really identifying those gaps where the women are saying that they need the most help. So designing and working with the women to identify topics, activities that make sense to them. So Elizabeth, you can talk a bit more about specifically what you've done in the areas that have been the greatest gaps.
Yeah, well, so the biggest, what I've noticed from most of the women coming forward, speaking with me, is the postpartum. So that's a big, I know this is becoming more common now, where people are more understanding about postpartum. So they're coming forward, they're needing support. It's actually amazing to see a lot of women coming out and not keeping it inside, because it's really important. It's a lot of women that do suffer with postpartum tend to suffer silently, and it's a scary disease if you don't.
How many stories have we heard of, from the past where oh, this person changed, and they're like, oh, she's crazy. It's no,
absolutely,
she's going through something right now, chemical changes. And I think the conversation has come a long way. Probably should go even further and having more resources. But I have seen a change, especially when you're looking at shows that explore situations back in the 50s and stuff. It's just so interesting to see how just mental health conversations in general have evolved.
Yeah, we've started to normalize the conversations around mental well-being. That, I think, has been the silver lining out of the pandemic. And so even topics like postpartum, which we've seen a big uptake or a big demand, I would say, that the people are saying there's a gap in it. The services that are available, and there's some really great services available. I'm not saying that there isn't. but the demand is so much higher than what is available. So we really are focusing on the postpartum a lot. We've got a number of things. Maybe you can tell which are some of the 3 areas that we focus on the postpartum, starting with the peer support.
Yeah, so we have the peer support, the warm line as well. So we just relaunched that. I was on hold for quite a bit, and quite a few hospitals and nurses were calling, asking for it because their clientele were looking for support. We're also going to be starting in September a peer support in person or virtual for postpartum. So that's what we're doing to support, because we're noticing that there's a big demand for it. If people need it, we want to support in any way we can, right?
It's not just in Winnipeg. This is across the country, the issue of postpartum. But here in Manitoba, our support for women is provincial. So it's not just focused here. So that's important. Something sad, I guess, but it's also very real, is in the last few years we've been hearing a lot about death by suicide when women are in postpartum, suffering from postpartum. We've had some high profile cases here in the province. And that, I think, has really opened up the discussion that postpartum is very real. It's a very real condition that women experience after childbirth. Normalize that conversation that it's okay to ask for that help. You deserve it. It's, you shouldn't be doing this alone. But the other part of that, Ryan, I think, is that it's not just always the woman that needs the support. It's the other parent as well. There's 2 people, and sometimes extended families as well. So the approach that we're taking, Elizabeth, I think you're looking at changing the manner in which we deliver and the content is to support. So talk about that.
So there's another program as well, which is called the Baby Blues and Better Days. So that program has already been in the works for many years. We're just revamping it a little bit to better suit, partners as well as their spouses, just to make sure that everyone knows and understands the idea behind postpartum and how to because you're spending all your time with your spouse, right? So they're going to be the first person to know if you have postpartum or see the signs to address them, to get help. This is going to be open to anybody looking to have children, having children. So we're kind of revamping it so that it's open to everyone. So if, let's say, your sister, your cousin, whoever, you want to make sure that they're taken care of as well. So
I think one of the other things we want to identify is that postpartum exists in every culture, but it's not always recognized. And in many cultures, the support systems are there after childbirth, right? So you have the extended family. The old saying, it takes a village to raise a child.
Exactly.
That comes from the fact that there are cultures, and I'll speak about the Indian culture, my heritage, East Indian heritage, is that after childbirth, in most cases, in the average family, middle class, I guess for discussion purposes, that the woman actually gets to rest for 40 days. She is pampered, like things are done for her. She doesn't go out into the kitchen and do work in there. I mean, there are exceptions, of course, but the majority, what my mother would have experienced, what some of my aunts would have experienced. If I had been living in India at the time that I was in childbearing, that's probably what I would have experienced. So with those 40 days, the mother and child are given that time to bond. There's extra support systems. Special foods are made. Special preparations are done where they're given healthy foods. We make a special crumble that's made out of cream of wheat and with lots of good nuts and things which is healthy, which helps with lactation and with other things. So those support systems. So often people in many cultures think, well, why would somebody even have postpartum? Like, you've got all this support. And what often happens is that they forget that there's a hormonal change as well, which causes the postpartum. And so I think that's the part about the education that we have to understand in the diverse community that we have here, that postpartum is very real in every culture. And asking for that help, whether you have that physical help and social support in your family or not, but there's other aspects of postpartum that only you know and you can have to deal with.
Mental wellness is something that you need to address at all times, and it doesn't matter your situation. People can go through things. Like, it could be one small thing. Maybe it's something you're struggling with your whole life. You may seem like someone who has like everything figured out or all your needs met, but you could still have challenges or some
and you're in a new country, and you're having to experience. So I mean, we are very. I think Elizabeth, you've indicated that the diverse population that we serve for the women's program is growing.
It's growing.
So we want to be able to continue serving that diverse population.
Yeah, and just to go back to the postpartum with the culture, there's also, single parents as well. That's a big thing. Adoption. There's just so many variations. So we try to touch on everything versus just making it into, one. Because like you mentioned earlier, when you have mental health issues, it doesn't, like, one piece doesn't fit every situation, right? So, but those are just ideas of what we're putting together with regards to the Baby Blues and Better Days. That's going to be starting in September. And we have quite a few other programs as well, like the disordered eating. So we have disordered eating as well. So that's another one that touches on it. Doesn't necessarily go with the postpartum.
When we're looking at, particularly in the support groups, why is it important to have that connection between individuals to move forward? Like, instead of like a one-on-one with like a therapist or like a mental health specialist.
First of all, I think I want to clarify. I think what you said is really, really important, that listening to somebody else is good. Mood Disorders Association of Manitoba is not a clinical serving agency. We do not have clinical intervention. Our service model is based on peer support. So you alluded to that it's so important to have that peer support. When you can identify somebody else who might have gone through the same experience, it makes it a lot easier for you to understand and share in that. And of course, Elizabeth, some of the peer support that you provide, you can talk about what the women have experienced who come to you for one-on-ones.
So everyone has amazingly great journeys that they're going through, but some of them are pretty intense, and a lot of the times they just want somebody to listen to them. They're amazing women who I peer support the women, so I say they're amazing women because we do peer support for everyone else. But the women that I do see, they just have a lot of life to give or joy, but a lot of them feel hindered because of the fact that they just feel like their mental health keeps them from enjoying life. A lot of the times we have conversations, and some of the stuff I can relate to them and offer support and guidance, but it's just there to have somebody to speak to. So with that, the one-on-one is great. However, when we go to the peer support in groups, we offer it virtually as well because people can't sometimes come to site. However, what I've heard from the groups in person, a lot of them are really fortunate because it gives them a sense of purpose, especially if not even a sense of purpose, but more of a sense of community. A lot of them enjoy it. A lot of them sometimes feel they work from home, they're isolated, they don't get out as much. So this is their excitement for the week. So they get a chance and an opportunity to meet other women, hear their stories, laugh, cry, discuss. It's private, it's confidential, but it's a safe place for them to be vulnerable.
As you're mentioning, Rita, Mood Disorders Association of Manitoba is just another tool that people can utilize in terms of dealing with it.
It's another resource available in the community. We work with the clinicians. We work with our professional licensed therapists and physicians and the hospitals. Absolutely. But what we do is we listen. And that's how we provide the greatest level of service to our clients, by listening and being a peer. And the reason we can do it effectively is majority of our staff who are trained in peer support have either lived or shared experience of mental health journeys of their own. So they've gone through it. They know what it's like. They can both be empathetic, at the same time help somebody find the resources, but also validate somebody else's experience, so that the person doesn't feel so alone and say, oh, am I the only one who experienced? No, there's 10 other people in this
we
group
all have.
who have gone through a very similar situation, and each one might have handled it differently. So what somebody's sharing in a group, how they might have handled something, might work for you, might not work for you, or bits and pieces of it might work for you. So I think those are important elements of peer support. The other piece I think is really important to remember, Ryan, is that when people are getting that clinical intervention, whether it's the doctor, a therapist, or other hospitalization, or whatever the case might be, so often the time frames in terms of getting appointments are far in between. They're also limited. You go to see a psychiatrist, you can see them for 50 minutes, and after the 50 minutes are over, that's it, till next month. But life happens in that one. Absolutely, the professionals have a very critical part in the support of the individual. But by providing that peer support and a safe space, a confidentially safe space for them, they can now be a bit more opportunity to help them get from appointment 1 to appointment 2, which might be 2 months down the road or 1 month down the road, by talking to somebody on a weekly basis. Sometimes, if need be, on a daily basis. So those are all pieces of the model that are very helpful. We're also moving, I think Elizabeth can add to this, into a model of more activity-based peer support. Peer support traditionally is a lot of talking and listening. Absolutely, that's critical, and we still continue to do that. But what we've also integrated into that is activities. That while they're talking about their mental wellness in subtle ways, they're also engaged in something. So in the women's wellness program, for example, what are some of the activities that you do?
So we actually bring in someone that does meditation. So we do a meditation, we do yoga.
Paint
there's
night.
paint night. There's also, affirmations. We're just all about self-love, self-appreciation, learning to love ourselves
sometimes
again.
We bring in guest speakers.
Yeah, absolutely.
And sometimes you talk about, I don't know, if the subject leads to somebody, maybe it's about baking or cooking, and people might bring their own things to share the next week for things like. And so it's very activity based. All
absolutely.
Of our programs.
And there's a dietitian as well that comes in. So every week is geared towards or themed, right? Mm-hmm. So we have specific themes every single week that we discuss, and we bring in guest people and to further discuss about how when you go to the doctors and there's a wait list. We also bring in professionals to come in during these meetings as well, during these workshops, to talk to us. And so we're working with them quite a bit to give the most information, resources, materials, everything for the people to know.
I know we touched on this just very lightly, but when we're talking about the diversity of the clientele and those who work at Mood Disorders Association of Manitoba, what does that bring to the conversation when you have people of diverse cultures and experiences in those peer conversations? Like, how does that diversity help in the conversations?
I find that it actually unites people a little bit more. I find that everyone is, especially within our organization, we have so many people from different backgrounds, right? So already the work culture, it's kind of interesting to hear everyone's backstory, where they're from, how they've lived, all their culture. So it kind of gives us the opportunity to see other people, especially newcomers, coming in and needing support. So we kind of have that, culture background a little bit to support. Seeing the peer support groups together of different culture, different backgrounds, it's becoming more and more common. And so a lot of people are actually really loving it. I'm actually seeing a lot more engagement and understanding their different backgrounds, talking about it, openly discussing it.
I think it's opening up the doors to more conversations, looking at the commonalities amongst ourselves, whether being that global village now, as opposed to the differences that we have. Absolutely, we should celebrate our differences, but there's also common things that bring us together. We're so blessed in Manitoba. It's one of the most diverse populated provinces that we have, and Winnipeg itself is a very, very diverse community. And so I think that is starting to reflect in the groups that we're seeing. And also the way in which we're now trying to manage, making sure that we can address those unique needs of the various diverse communities. and maybe just change the conversation a little bit. Moving on to the youth, that's where we're seeing a biggest change in terms of clientele. Okay. We are seeing youth from diverse communities reaching out for help. So,
well, that's good to hear, because I know when I was growing up, dealing with things, I felt it was like, no, it's almost a sign of weakness if you go and say like, hey, I'm struggling, I need help and things. You always gotta bottle it up inside. So that's great to hear that there are youth seeking out help.
We still have a long way to go. I think but normalizing the conversations amongst youth has started to happen. We run what we call our MAD camp, which stands for Music, Art, and Dance, and that is again activity based, allowing kids who many of them anxiety, depression, suicidal thoughts, gender issues, bullying, cultural adaptation. These are some of the common ones that we hear about that kids come to us for support. So real diverse participants, but also the diversity of the challenges that they bring with them. And so by hearing what somebody else might be experiencing and how they managed in school, or whether they managed in the family, how they managed the bullying, how they managed adapting to a new country, those are all very significant pieces of, there's so much going on in a young person's life.
Well, they're learning who they are. They're trying their identity. Exploring.
So our MAD camp is, again, very, very successful. We're already full to capacity. We've started a waiting list already for it for the summer. We're going to be providing 4 2-week sessions, and which is a very holistic approach for the 2 weeks, where the kids are provided everything from meals and snacks to outings to activities. We have a fully fledged music room with lots of instruments, and kids can learn to play a new instrument or jam or do whatever they want to do with their music. Again, it's a lot of led by the kids themselves. We have obviously staff who supervise, but the kids kind of decide what they want to do. There's opportunities to do art. They can create their own Picassos, dance. They can choreograph a piece that they want, or drama, do a skit, do a poem, whatever creative way that they can talk about their wellness journey. The other part that happens, really, that what we love in the service that we provide for youth, is they make friends, they socialize, and those friends continue, not just at the camp for the 2 weeks, but throughout the year. So many of these kids come back in the fall. We do a once a week continuation of the camp, where again, if you have music or art or dance, they can come in. We have the space for it, but it's a way for them to continue engaging with each other. It's an after-school program, so it's part of our overall youth program. But that is the signature part of that youth program, help to support the youth in our community.
As you're changing over to more of an activity-based approach on things, why do you think activities allow people to open up a little bit more? Because I find that with myself as well. When I'm having conversations with people, if I have something that I'm doing, it's almost easier to start talking about something else then. It almost takes the pressure off a little bit. I guess just based on both of your experiences at mood disorders, why do you think it is that activities allow people to take those next steps a little bit easier?
Well, first of all, I want to just again emphasize that we're not clinicians. I'm not speaking here as a medical doctor or a researcher. I'm simply speaking from
just based on your opinions.
Our experience and what we see in terms of what the need for it. What we found was when things started to get normal again, when people started seeing each other, many people still not comfortable going into groups, but a lot of people wanted to go into groups. So what we heard from folks was that I love talking to other people, but oh boy, I wish I could just do something. I just haven't been able to do some of these things. So we listened, and we said, okay, let's start with something small. What are some of the kinds of things you want to do? So you might work as a team of 2 or a team of 6 when you're doing your thing. For one great one that we have activity-based, we do games night on Friday nights. It has become one of the most popular programs that we offer. So we now have about 20 people participating in it, and we're open for more. We had 2 vendors in Winnipeg who were kind enough to donate a whole lot of board games. So these folks who are struggling with things or just want to socialize, it's not just a social, group on Friday nights. People are genuinely needing that additional support. But by coming into that games night, it allows them to socialize, first of all, because many of them might be home alone, lonely, and have nobody else, have no families. But this is one place, and nobody to talk to about their struggles. This allows them to do that. But also that learning from other people, how are they managing? So we were going to actually put a hiatus for it for the summertime and say, okay, we don't have the staff to do it every Friday night. But my goodness gracious, the folks that said, no, you absolutely cannot do that. And we had 2 volunteers from within the group who are trained, who are regular volunteers with us, to say, I'll do it for the whole summer, but don't put a hold on it. So that's the kind of engagement we've gotten. We have another wonderful program called Tea and Tales. And next month we'll talk about the need for seniors, and that's a program for seniors.
Yes.
Which is, again, activity-based. Seniors that come together, do various things. But in that activity-based share, that hour, or sometimes, the seniors I think is almost gone to 2.5 hours now. It's a whole afternoon.
Wow.
People are engaging, but they feel good when they leave, and they look forward to coming back. So that's what we've noticed, is people asked for it, and we adapted to it without sacrificing the model of peer support and what peer support really is.
Yeah, an evolution of the peer support model. Okay. Elizabeth, why don't you tell us a little bit more about some of the other programs and conversations and things that are happening specifically surrounding women's mental health and mental well-being, and maybe, if someone is interested in finding out more or joining these kind of peer support systems, what sort of steps or things can they take?
Right now, the first step is just reaching out. So reaching
big
out,
step.
Big step, because we need to know that you want to at least do something to support yourself, right? So we want to support in any way, but the first step is just reaching out.
Yeah, Mood Disorders Association of Manitoba. Just Google that. You'll probably find everything you need.
Go to our website.
Go to our website, absolutely, and we'll be able to, all the information's there. So my email is womensprogram@moodmb.ca. Reach out to me. Let me know. I'll contact you, whether by email or by phone, whatever your preference is. We'll have a chat. And there's plenty of programs, like I mentioned. So we have 2 programs now. We have in person and virtually. On Tuesdays, we have the virtual one. It's from 6 to 7 p.m. So it's a group of women, as long as you identify themselves as a woman. And so it's virtually on Tuesdays from 6 to 7. So we have Sarah right now, Sarah Shella, that does the facilitating of it. And that's for anybody that can't come to site. And then on Thursdays, we have the peer group in person from 6:45 to 7:45. So first off, I would just, whoever calls in, says that they want to more support, we kind of just gauge like what kind of support are you looking to. What anybody that calls in generally has some sort of mental health illness or disease, but it's not necessarily diagnosed. It's how they feel. It could be anything. I mean, there's depression, there's anxiety, there's a lot of different types, but we just have a conversation, and then I usually kind of custom design or guide them to the next steps of, whether it's in person, whether it's one-on-one peer with me, whether it's the workshops that we have, like the wellness workshop I mentioned earlier, or the postpartum workshop that we're going to have, the baby blues and better days, the disordered eating workshop, or the women's wellness workshop.
And for those who are interested in wanting to find out more, like Rita said, you can head to moodmb.ca.
Yeah.
Elizabeth, Rita, thank you so much for joining me. Let's keep the conversation of mental health and mental wellness going.
Absolutely. Let's normalize it, and let's not be afraid to ask for help, because that is your greatest strength.
Thank you for taking a mental health break with the Mood Disorders Association of Manitoba and U Radio. I'm Ryan Funk, and take care.